work or advance since we celebrate this yearly every 28th of April. So it's officially tomorrow. So we are the first to celebrate this day. Welcome to our 39th Kapihang OH. Welcome to our first-time participants, and we welcome back our regulars. This is a monthly session where we tackle the latest updates in the field of occupational safety and health. We hope that everyone is safe and healthy. The Philippine College of Occupational Medicine Quezon City Chapter is very much delighted that you accommodated our session for tonight. I am your moderator for today, Dr. Jason Jan Cabigon, a member of the board of the PCOM Quezon City Chapter. Tonight, we will commemorate the World Day for Safety and Health at Work 2022 with the theme Act Together to build a positive safety and health culture. But before anything else, we are gently reminding everyone of our house rules. First, kindly mute your microphones so we will not hear anything else aside from the voice of our guest speakers. Please turn off your phone and computer cameras so it will not slow down and lag our virtual kapihan. If you have questions, please type in the chat box and we will read them later during the Q&A portion. For those that will request e-certificates of the session, it will be provided through email. Again, it will be provided through email as long as you finish 90% of our kapihan tonight. If you have technical concerns, please type it as well in the chat box. So those are our house rules. Without further ado, let us officially start our Kapihang OH. To welcome us all to our 39th Kapihang, ladies and gentlemen, our PCOM Quezon City Chapter President, Dr. Catherine Artais Carriaga.
Thank you, Dr. Cabigon. Greetings of good health and safety. I would like to welcome all of you doctors, occupational safety and health advocates, the Philippine College of Occupational Medicine, national officers, members, Quezon City Chapter officers and Board of Directors for tonight's virtual gathering. Our organization joins the entire world in commemorating the World Day for Safety and Health at Work this 2022. And we are honored and grateful to have with us tonight an array of distinguished guests and panelists. From Executive Director Noel Binag of Occupational Safety and Health Center, Dr. Yuka Ujita of International Labor Organization, Assistant Secretary Maria Teresita Cucueco of Department of Labor and Employment, Engr Joey Ortega of Petron Corporation, and Dr. Marilou Renales, accredited Occupational Safety and Health Consultant. The World Day for Safety and Health at Work is celebrated every 20th of April annually to promote the prevention of occupational accidents and diseases globally. And for this evening's 39 Kapihan, themed as Act Together to build a positive safety and health culture, let us join, listen, and learn from the experts as we commemorate this special occasion. Good evening to all.
Thank you, Dr. Carriaga. And to give a message as well, since this is a very special occasion, let's all welcome the Executive Director of the Occupational Safety and Health Center, Director Noel C. Binag.
Department of Labor and Employment, Assistant Secretary, Maria Teresita Cucueco, Dr. Catherine Carriaga, distinguished resource speakers, officers and members of PCOM, Quezon City Chapter, esteemed guests and participants, ladies and gentlemen, Magandang gabi po sa inyong lahat. I commend the PCOM Quezon City chapter for organizing this event, as it is indeed timely to re-emphasize the importance of social dialogues in the development and implementation of occupational safety and health programs, both at the national and plant levels. Republic Act number 11058, entitled An Act Strengthening Compliance to Occupational Safety and Health Standards and Providing Penalties for Violations thereof, already laid down the foundation for social dialogues. The law was crafted through consultations with all stakeholders and clearly defined the rights, duties, responsibilities of employers and workers in the bipartite development of occupational safety and health programs at the plant level. Nearly 2 years after the implementation of this landmark OSH law, however, the DOLE Inspection Information Management System showed that compliance of establishment with the OSH standards is still far from our desired levels. The current state of OSH in this country calls for more action from all stakeholders. With the limited number of the DOLE labor inspectors, enforcement needs to be complemented with building positive safety and health culture for all Filipinos. According to the International Labor Organization, positive OSH culture is a stage of development where there is an open communication and dialogue between workers and employers, where workers feel comfortable sharing their thoughts about incidents and concerns while there is leadership and commitment to OSH by the employers and senior management. Its core values are social involvement, justice, trust, sustainability, participation, resilience, and flexibility, and development and growth. To achieve positive OSH culture, we must transcend 5 stages of development. First is the pathological stage where employers and workers do not care about safety rules, about violating safety rules. Second is reactive stage where safety becomes important only after an accident. Third, there is this calculative stage where workers avoid problems in advance to improve the work environment. Fifth is the generative stage where OSH is built into ways of working and thinking. We at the Occupational Safety and Health Center have no power to enforce the OSH standards. Our mandate is to promote the culture of OSH in all workplaces, in all industries throughout the country. We are implementing one of our flagship programs, the Vision 1 Million at OSH Advocates, through the conduct of research, information dissemination, training, and providing key technical services such as PPE testing, work environment measurements, and medical surveillance, among others. For this year, we are also holding the 12th Gawad Kaligtasan at Kalusugan, or GKK, to further promote the culture of OSH by recognizing the best practices and achievements of business establishments and individuals in the field of OSH. For this year, we are actively inviting participants from the public as well as the micro-establishment and the informal sectors. Their OSH programs may not be as competitive as the medium and large establishment, but we also would like to recognize their efforts to improve safety and health in their workplaces, to encourage them to strive further. This way, we promote the culture of OSH in all workplaces. I hope to see all the business establishments which are affiliates of PCOM Quezon City members as participants in this 12 GKK, and I hope that PCOM Quezon City continue to be one of our OSH champions. Magandang gabi po at maraming salamat. Mabuhay ang PCOM Quezon City Corporation at mabuhay po ang lahat ng OSH champion.
Thank you, Director Dinag. On behalf of the PCOM QC chapter, let me present the Certificate of Appreciation to Director Noel C. Dinag. The certificate reads, the PCOM Quezon City chapter presents the Certificate of Appreciation to Director Noel C. Dinag in grateful acknowledgement for giving your message during the chapter's 39th Kapihang OH. Signed, Dr. Jose Angelo C. Taylor, Chapter Secretary. Signed, Dr. Catherine Artais Carriaga, Chapter President. Thank you once again, Engineer Dinag. To our dearest colleagues and beloved guests from all sectors of the workforce, the chapter is very honored to introduce our respected speakers for tonight. Not one, not two, not three, but we have 4 distinguished speakers. Let me introduce all of them first. Our first speaker is Dr. Yuka Ujita. She is a senior specialist on occupational safety and health in the International Labor Organization Decent Work Technical Support Team for East and Southeast Asia and the Pacific. Dr. Yuka Ujita, a Japanese national, is a medical doctor by profession and holds PhD in preventive medicine from the University of Occupational and Environmental Health, Japan, as well as a diploma on occupational health. Her work experience in the medical field spanned over 12 years, serving for several medical facilities. As a certified occupational physician, she offered OSH services to both workers and employers in various settings. In 2003, she joined the ILO Sub-Regional Office for East Asia. Since then, Dr. Ujita has contributed to improvement and promotion of safety and health at work through policy and technical advice, training, knowledge sharing, awareness raising, and project backstopping, both at the HQ and in the field offices. The areas she has particularly covered include OSH data, safety and health of vulnerable groups of workers, and hazardous child labor. Again, she is Dr. Yuka Ujita. Our second speaker for tonight is well known to all of us, and we are very honored to have her again as a speaker for tonight's Kapihang. She is the Assistant Secretary for Regional Operations, Labor Standards, and Special Concerns of the Department of Labor and Employment. She is also the concurrent Director 4 of the Bureau of Working Conditions of the same institution. A bona fide member of PCOM QC. Dear friends, she is Assistant Secretary Maria Teresita Cucueco. Our third speaker is a professional electronics and communications engineer. He is the terminal manager of Petron Harbor Center Operations and the safety officer of Rosario Terminal Petron Corporation. He is an accredited Port Facility Security Officer, an accredited Pollution Control Officer, and of course, an accredited Occupational Safety and Health Consultant. An awardee of the 2021 10 Outstanding Safety Professionals of the Philippines by the Tokay Professionals. Ladies and gentlemen, he is Engr Joey Ortega. Our last speaker, and certainly not the least, is another accredited Occupational Safety and Health Consultant by the Department of Labor and Employment. She is a practicing OSH Consultant and Occupational Medicine Physician. She is the former chair of the Department of Environmental and Occupational Health of the College of Public Health, UP Manila. She is a diplomate and a fellow of the Philippine College of Occupational Medicine, where she was a former national director and specialty board member. Another pride of PCOM Quezon City chapter, she is Dr. Marilou D. Renales. I am sure you are all excited to learn. To start the discussions, let us listen to Dr. Yuka Ujita.
Thank you, Dr. Kapihang, for your very kind introduction. Good evening to all. First of all, thank you very much for inviting the International Labour Organization. And actually, this is my great honor and privilege and pleasure to share the ILO's approach and experience with you to observe the World Day for Safety and Health at Work 2022. So let me share my screen.
Dr.
Because
Taylor.
I have only a few minutes, so let me start. Okay, so the theme of this year, the Safe Day, is the acting together to promote the safety and health culture, right? Acting together. And this is the outline of my presentation, the short presentation. And I don't know how many of you are familiar with International Labour Organization, ILO. Of course, you may heard about the ILO, but let me start just a quick introduction of my organization. ILO is one of the UN specialized agencies like WHO. And it was established in 1919, before the United Nations itself is established, very old organization. And we have the very unique tripartite structure that consists of the government, employers, and workers. And everything, the decision or the approach or the whatever, the policy, programs, publication, all of the ILO's instruments and tools should be discussed and agreed by our tripartite constituents, government, employers, and workers. And of course, the Philippines is the member states of the ILO, and very strong support to OSH with the all tripartite members, government, employers, and the workers. And our goal, our mandate is decent work for all. And in fact, the occupational safety and health is then one of the very important element of decent work agenda. And today, I like to emphasize just one point. The first point is the guaranteeing the rights at work. Of course, health and safety is the rights of human being, our right, the workers' right. But currently, the discussion is ongoing to recognize and include occupational safety and health is one of the fundamental principles and rights at work. And very likely in the International Labour Conference in coming June, all our member states will adopt to include safety and health as fundamental rights at work. Okay, so what is the ILO strategy on OSH, occupational safety and health? Actually, the impact of OSH deficit is high. This is the latest estimates from the ICO, International Commission on Occupational Health. Every year, almost 3 million people die due to occupational accident and disease globally. And as you can see, 80% of the death is due to work-related disease, not by the accident, but disease. In addition, 402 million people suffering non-fatal occupational injuries globally. And I like to emphasize that those deaths, those injuries are preventable, right? And your role, my role, is to prevent this kind of accident, injury, and disease. I decided to become a medical doctor very, very young, when I was 4 years or something. But soon I thought, yes, the work in the hospital, the care of the patient is one of the very important role of the medical doctor. But I was interested in more in prevention. Before they get in the ill, the sick, maybe the people are more happy to prevent such kind of ill health. And the safety and health at work is actually the preventive medicine, preventive action. So our role is very important to prevent these death, injury, and disease. And the ILO has the global strategy on occupational safety and health. There are only two main pillars. One is the establishment and the promotion of the preventative safety and health culture. The executive director of the OSH Center, in his remark, he emphasized the importance of the safety and health preventative culture. And actually, this is the starting point on safety and health. Without the goodwill, without the motivation, and without the awareness, we cannot start anything. As medical doctor, you know very well, even if we have the very super, very high technology, very efficient treatment, medicine, or the operation, whatever, without the motivation, without the will of the patient to become healthy, we can do nothing. No care, no cure. It's the same thing. Without the motivation on safety and health at work, we cannot support, we cannot assist the workers, right? And second pillar is systems approach to OSH. That is the continuous improvement of occupational safety and system at the national level and also enterprise level. That is through the OSH management system or the OSH registration, policy, enforcement, compliance system. All the system should be continuously improved. And the social dialogue is key to implement these two pillars, both the preventative safety and culture and also systems approach to OSH. So what is the social dialogue? This is very strange word. To be honest, before joining the ILO, I never heard about the social dialogue. And they actually, when you translate social dialogue into Japanese, it is very strange wording in Japanese. So what is the social dialogue? Social dialogue is all types of negotiation and consultation, or simply the exchange of information. between or among usually the representative of government, employers, and workers. And the social dialogue may be informal or institutionalized, and often includes both types. So informal social dialogue is just a conversation, just greeting between the workers and the employers. More institutionalized is the government and employers organization, workers organization. And the social dialogue may take place at a different level, international, national, regional, or workplace. And the various forms of social dialogue exist. In fact, usually in the ILO, we call it the tripartite process. But in terms of the occupational safety and health, I like to say tripartite plus process is more important for us, because usually we are dealing with health, sometimes environment. These are the issues beyond the world of work. And we have to engage not only the traditional, our tripartite partners, but we have to engage involve with actors representing the specific concerns and interests, including NGOs and other organizations. And the bipartite relations is very common at the workplace level. It's the bipartite OSH committee in the workplace. And the social dialogue is a key tool for collective bargaining, especially for the working conditions, the wage, working time, or the terms of employment. And also, the social dialogue is important to the workplace cooperation, ranging from the information sharing and decision making. And in terms of the OSH, workplace cooperation is quite very, very important. And what kind of, the social dialogues is important at the national level? Is the communication or the mutual understanding or the collaborative culture towards the common goal, priorities, and objectives. And there are a lot of actions can be taken at the national level regarding OSH policies or the regulatory frameworks, legislation, laws, and regulations, and also agreement on OSH. And more practically, the guidance and technical assistance. Maybe some of you are engaged to develop the technical, the guidelines or the guidance. And also the awareness raising campaign like this, the Safe Day, is the tripartite nature at the national level, as well as at the enterprise level. And OSH research and data collection, the use of data, the use of information on OSH, this is the very important action at the national level. And now I like to say the social dialogue is, yes, the usually employees, workers, and government, but I like to say the social dialogue tripartite plus process, especially in terms of safety and health, the collaboration between the labor and public health sector is very, very important. And actually during the COVID-19 pandemic, this collaboration was really highlighted. And the Philippines is the champion of this collaboration between the Ministry of Health and the Department of Labor. I took this the text from the safety report this year. So your case, the Philippines case, is actually included in the safety report because you did very good job, the working closely between the public health and the labor. And you produce a lot of tools, the materials, and the instruments to prevent the COVID-19 risks at the workplace. And at the workplace level, what we can do, the first, of course, you know very well, the safety and health is the basically employer's responsibility to ensure the workplace without any risks to health. It address the chemical, physical, biological substances and agents, and all of the work process, work items should be ensured without any risks to health. And as occupational safety practitioner, you have to provide the technical advice to both workers and employers, and to remove that kind of risk to health. And if you cannot control the risk, then the employers should provide adequate personal protective equipment at no cost to workers. But I like to say the PPE is the last resort, the least hierarchy priority in the hierarchy of control, right? And also the workers are responsible to prepare the emergency plan, response plan, or the preparedness plan, any emergency, including the outbreak. And the workers has rights to be protected, and they have rights to remove themselves from the workstation with the imminent danger. And also the workers have right to be adequately share the information and provided the training on OSH. But at the same time, the workers should have duty to cooperate with the employer. Even though the employers provide the adequate OSH measures, if the workers didn't accept or they didn't respond or they follow the instruction by the employers, nothing happened. So both employers and the workers have responsibilities in terms of OSH. And the ensuring workers employer cooperation on OSH, that is actually the social dialogue. And we know it works. If the social dialogues work very efficiently, the 64% fewer safety incidents, 58% fewer hospitalization in workplace. But still, you can see the right on side, over 300 million workers hesitate to report or they raise the OSH issue because of the fear of the negative impact. So this is the typical example, the lack of the effective practical social dialogue at the workplace. And our law to facilitate this kind of cooperation between workers and employer, because we are in the middle, workers and employer, and in the position to provide expert advice on health and safety and prevention, of course. So we have to provide advice to workers and also employer. But I like to say we have to work together with workers and employers. We have to learn from workers. We have to learn from employers because they know very well about the hazards and risks in their workplaces. We have to respect their capacity and we work together with workers and employer. So what we can do, this is the global call to action just adopted in June this year. And that is the human-centered recovery from the COVID-19 pandemic. And the protection of all workers is one of the 4 key areas. And we are working together to assist employers and workers to protect of all workers through social dialogue. Thank you very much. And finally, I like to inform you that your secretary, Mr. Beto, he kindly provide us the message, video message to the ILO. And just 30 minutes before this event started, it was posted in our global website. So if you can Google the ILO and safety, you can go to the safety page, and the video message from your secretary are there already. Thank you very much. Back to you, Dr. Capcom. Thank you.
Thank you very much, Dr. Ujita. We are truly honored to have you tonight. And yes, we will truly check the video presentation. And thank you as well for recognizing the efforts of the Philippine OSH advocates. To our dear participants, we are requesting everyone to type your questions in the chat box. But let's await to finish all of our speakers before we open the floor for question and answer. At this point, let us all welcome Assistant Secretary Maria Teresita Cucueco.
Good evening to my colleagues, in PCOM, so that we don't waste time. I'll share my screen, please. Can I share my screen po?
Go ahead po, Doktora.
Kasi ayaw pa. Do you want? Okay. So, yes, we congratulate PCOM and to all our OSH advocates as we celebrate the World Day for Safety and Health. Even if it's tomorrow, I think for other countries it's already tomorrow, so it's really a celebration of safety and health. But I hope you know that it is originated not from a celebration, but from a memorial of those who died because of accidents and illness, injuries at work. But turning it to a more positive approach, now we have to really look into and provide all the necessary means for safety and health. And that is why this should drumbeat our advocacies towards reducing the risk at work, reducing accidents and illness at work. So this will be short. I hope I will make it short. We do and we should have the safety and health culture is there before the pandemic. It exists within the pandemic. It should also then extend beyond any pandemic. That positive safety and health culture remains important in motivating, supporting, and giving a value of safety and health for all workers, not only during crisis, but in all times. So it is really a culture. It is a mindset, and that is what we want to always happen. My take for everything here is, just think, and this is why I'm such a big advocate of those two terms of unsafe act and unsafe condition. Turn it around, make it positive. It makes you think what is safe, what is a safe act, what is a safe condition, and that should be our way forward in addressing all issues and concerns in safety and health. It's the celebration is supposed, it's the theme is acting together. It always has to be an act together, because our challenges will never, we cannot do anything alone. We always have to have the support of everyone to ensure that our safety and health strategies, all activities will provide the means towards optimizing safety and health in the workplace and in the safety of the workers as well. So we're seeing that, safety and health is being driven because this is the need. There is a compliance to mandatory requirements. And during COVID, there were limitations in enforcement. However, because of these limitations, the acting together now has to go to the establishments and make sure that the responsibility, Dr. Yuka said it is really from management, it is from the workers and government, just to make sure if any support or assistance is needed so that they can bring in safety and health. And now we are seeing new work systems. It's not just a new work system like the telework, different work arrangements, alternative. This is already there. We're dealing with it. We have to deal with it. But there are new issues that are arising as well. There is climate change. And with climate change, we will also have to address it through a different work system. There is also the artificial intelligence concerns, where now there would be, it's still going to be technology driven, but we are also going to be exposed to a different set of hazards and risks. And now, of course, and this was truly exposed by COVID, the mental health and psychosocial concerns have really showed us how vulnerable our mental health state can be as we are facing different risks, different challenges at work. So you will see again here tripartism, because that is also the anchor of DOLE's decisions. We never have a decision that is DOLE alone. We really consult our stakeholders, number one, the employers, the workers, and then going beyond, and this is tripartite plus, the other sectors are the government, either our government partners, the academe, these, the other organizations. This will form basis of our policies. Then from policies, we also have to then bring it into and implement it through advocacies. Then once we know that it is now a policy and it should be enforced, then inspection will come out. I hesitate to use inspection by the DOLE. I'd rather you also do as audit or inspection in your own establishments, because that will be the primary, that is going to be your basis in seeing how safety and health programs work in your establishments. If you do not do these kinds of activities within your establishments, then definitely what do you expect when the DOLE comes in? They will see deficiencies or non-compliance. It has to really, the work has to start from the establishment, and you will really see a growth in terms of what other safety, how you will continue to address safety and health, and you will be addressing it really in manners that will really help the workplace. So from policy response to support to operations, there should be acts together. You see the interagency joint, it's interagency, it's acting together now as government. In our different department orders, we also had to bring in consultation. When a department order is passed in the DOLE, we consult the employers, the workers, and the experts group. It may not only be happen, it will not happen in one sitting, it will take many, because other comments have to come in. And then the support for all of this cannot just be done by DOLE itself. That's why PCOM is here to also assist, especially when we have health concerns that should be brought about, or health policies that we also need your support for implementation. And that tripartite mechanism, you will always hear social dialogue is really a manner of talking, it's a dialogue, but bringing in together not just two people, it's three, because of the workers, management, government, and more. So these are the mechanisms. COVID from the 2020 showed us also a spectrum of responses. So kumbaga, in 2020, we really had to focus first on workplace prevention. It was a period of upheaval because we did not know what COVID, we did not know anything about COVID. There was such big upheavals in our workplaces. We didn't know really how to respond, but we were also looking at best practices so that we were able to respond well, and policies had to come out. In 2021, that this was now where we saw interventions that were working, and vaccines came in. So this was now a period of survival. We were surviving with COVID. And now in 2022, we would like to sustain all those practices, all those best practices. And we are reviving economies, we're reviving businesses, as well as not just reviving safety and health, but we're also improving safety and health measures as they have happened. I will now go briefly. These are the issuances. You see how we were putting our acts together. The DOLE, we had to work together with DTI, and we had to present this to the IATF for concurrence for their comments. And these are the elements that were part of the DTI DOLE guidelines. And that is why you see all of these elements, because the DOH, the DTI, the transport, they also had to bring in their comments and inputs. And that was why this is a very comprehensive policy issuance that was brought out. Other issuances that then came out were supportive of the first issuance on the prevention for COVID. And then we also had to address now vaccination, testing, strategies for testing. So these were all of the issuances that came out. And then towards the end, our issuances on vaccination. It was really very difficult. That was a challenging period, because it had to take the IATF to say that for those doing on-site work, vaccination is needed. Otherwise, they needed to have the RT-PCR. So this is just to show you what we have inspected. This is a safety and health as well as general labor standards. That's why this is 59. If we were just going to the COVID, we did more than this. We even reached 94,000 establishments, but that was looking at COVID. So you do see that, and this is what Engineer Binag said earlier, compliance for safety and health is really one thing. Most likely it's because of the law and the IRR, which spelled out what is safety and health, what is needed for compliance. And because we already had a set or a checklist of compliance measures, and companies may not have been able to comply with it fully, you would see the initial compliance rate. However, it would have, after this, there is an improvement. And I don't think I have that slide, but there is an improvement in compliance after deficiencies have already been given by the DOLE to the establishments. So these are the top 5 safety and health standards, that deficiencies, very basic, no first aider. We understand there was really difficult in the training, but these are certain, these are basics that are needed for safety. And no safety officer, when we know that for COVID, the safety officer has so many roles, and that this COVID made sure that a safety officer should always be present in many of the activities in companies. So then the non-compliance with fire safety, which is so important so that we could prevent incidents of fire, non-registration and non-submission of the annual report. And this is for the policies for diseases, illnesses, needing policies and programs. We also see that there is non-compliance, but we see a good compliance in terms of all of these policies. For COVID WAIR, this is a reporting of COVID cases. There was 128 submitted establishment that submitted in our online system, and there were 13,000 establishments that said that their workers had COVID, and it was translated to an 84,000 plus workers with COVID. Whether it is the workplace or from community, that was beyond us. What we just wanted to see was what were the workers, the number of workers affected by COVID. And actually the ECC went further and tried to see if they could match like the benefits they were given for compensation. If it was the number of workers who were applying for that compensation would be very close to the workers who were confirmed with COVID. So this is, of course, we continue our work from submissions, even from work alert. And these are the reports for fatal, non-fatal. We have, see for 2021, there was a big number of fatal incidents, and you would see that different type of industries where you would have this fatal incidents. Of course, you would see it's so high for the highly hazardous, such as construction. This is just to give you an idea on the details of the work alert data, and we continue to revise, our review towards improving the standards. At this point, we are about ready to finalize the updated standards. There are so many updates for this because of the law, and because since 1989, so many policies, actually so many interventions in different departments have come out, and that is why we had to look at this well. There were also we also now look at the standards that it is going to be a risk-based classification of workers. There should be gender mainstreaming, and all the policies are still should be harmonized with the OSH law. And we also had to consider emerging work systems that is now present, like telework. So these are the standards that are being, and we are also renumbering it differently. And these are the rules that will be coming out, and additional rules from other sectors that are also going to be included. So having said that, in this World Day for Safety and Health, it really has to be an act together. We can only proceed, or we can only have the best practice if we listen to each other, if we are able to coordinate our actions together. Otherwise, if it is fragmented and we also do not know, how it is going, solutions are not being discussed, then we are not really being able to provide the necessary solutions that may be needed. So we still have so many work or so many tasks ahead of us. We have to expand our focus on safety and health because there are the new forms of work. We need to, communicating safety and health will be lost if you're going to do it in a complicated manner. It is best that it is simply stated and that you provide the necessary guidance. Voluntary compliance will still be the best because that is now a culture that we have developed. We have to have our efforts being collaborative. We have to upskill our workers as well. And we have to address concerns on mental health. So acting is an aspiration of everyone towards safety and health. It's our commitment towards really achieving this goal. And it will happen if there is a team that will bring it all about. And let me thank you again for inviting the DOLE to present this. Happy World Day for Safety and Health. Good evening.
Thank you very much, as always, ASEC Cucueco, for always providing the roadmap, especially during this pandemic and even beyond. So we still have 2 speakers for tonight, but before we continue with our program, let me invite again Dr. Yuka Ujita and ASEC Cucueco for the certificate presentation. To our dear participants, we are not yet done. We still have 2 more speakers, and then we will open the floor for Q&A. The certificate reads, the Philippine College of Occupational Medicine, Quezon City Chapter presents this certificate of appreciation to Dr. Yuka Ujita, Regional Office for Asia and the Pacific, International Labor Organization, for serving as resource speaker of the Chapter's 39th Kapihang OH, act together to build a positive safety and health culture, given this 27th day of April 2022. Signed, Dr. Jose Angelo Taylor, Chapter Secretary. Signed, Dr. Catherine Arta Iscariaga, Chapter President. Thank you once again, Dr. Ujita. Thank you. We are truly honored. With the same citation, let me present the Certificate of Appreciation to Dr. Maria Teresita S. Cucueco, the Assistant Secretary of the Department of Labor and Employment, for serving as resource speaker of this chapter's 39th Kapihang OH. Thank you once again, ASEC Cucueco. Moving forward, ladies and gentlemen, let us welcome Engineer Joey Ortega.
Ay, good evening, isang ligtas at malusog na gabi sa ating lahat. Ako po ay andito ngayon. I have 3 challenges before this speech, this sharing. And I would like to share first my slides.
Go ahead, Engineer.
Thank you. Thank you, Doc. Okay. So, sabi ko nga kanina, I have 3 challenges before taking this stage. Right? First challenge is I have to take away my trauma of talking with from the non-medical team to a medical team. The first time that I talked to a medical people was in 2011, I think. And this is after 11 years, I have to talk to medical people about safety. And second is how I can deliver my 22 slides for 10 to 15 minutes with your takeaways after this sharing. And lastly is how can I convey a message that itong bisperas ng World OSH Day for 2022 ay meron tayong maiuwi agad, or bago tayo matulog ay meron tayong maalala, no? So for Petron, we have a theme for especially for terminal operations, tatak world class, and we borrow the Vision 1 Million theme. We care our people, we care our environment, we care our stakeholders, no? We care about all the stakeholders of our operations. We share our knowledge, our talents, our skills to the company, to the local, to the community, to our people, and we dare to go beyond compliance, and that is our mantra. Safety is a way of life. For Petron, inculcating safety or OSH to our employees was a mandate, no? From the top management of Petron, signed no other than by our president, Ramon S. Ang. And our terminal operations, the divisions kung saan ako nabilong, no, yung division namin, our vision, mission and values also highlighted the compliance and attaining a loss-free workplace and leading the industry on health, safety, and environment. Actually, that is our mission. And all our terminals in the whole Philippines are also registered and certified to IMS, or the Integrated Management System, for the 3 systems: the Quality Management System, the Environment Management System, the 14001, and the ISO 45001-2018 version. And if we are a practitioner of management systems, we can realize, and we can see that the 7 principles of the quality principles, the 7th is the relationship management, and this is very important in inculcating or implementing our OSH program in the workplaces. And going towards the ISO 45001-2018 version certification, the most important thing, no, on top of the top management commitment and leadership is the consultation and participation of employees, of all workers in the workplace. So that is very important. And the most important one, especially in programming and implementing OSH program in the workplace. In Petron, we started our OSH program. The concept was started in behavior-based safety. But in 2018, we signed a contract with a American company, LPS Inc., and we implemented a loss prevention system in the company. In fact, one of the tools that we use with this system is the LPSA, or the Loss Prevention Self-Assessment Tool. In the Loss Prevention Self-Assessment Tool, all workers are empowered to make a risk assessment without any documentation. They just memorize the AAA, the 3 A's of the Loss Prevention Self-Assessment. And that is the assess the risk, analyze the risk, and act to control and mitigate the risk. So sa aming workplaces, we implemented, this is already the 4th year of our implementation of the loss prevention system. And in the timeline of our implementation, the first year is the concentration of deploying the core team, or the training of the core team and the key personnel in implementing the loss prevention system. The second year is focused on the use of tools. So we have different tools for different aspects of the system. And we have, the third year was the second is the 100% awareness of the workforce for the loss prevention system. And the third year, our milestone was to use the tools, the proper use of tools. And the fourth year, where we are now, is the use of tools with quality. So this is the quality, using the tools with quality already. So we're already making stewardships and reviews, quality reviews of all the tools that we are using. So, and I was just sharing earlier that one of the tools is LPSA, or Loss Prevention Self-Assessment, where we have 3 A's: assessing the risk, analyzing the risk, and acting on the risk. And this tool empowered all our workers down the line, the lowest rank of all our workers, including service providers. Okay, and with the implementation of all of these loss prevention tools, we have to have a change in mindset. So before, we are using in the program the word program. Now we use the word system, because we have to institutionalize. Because if you are just using the word program, it is dependent on the person or on the specific period. But if it's a system, it is institutionalized. And as you can see, we have the traditional approach, we have the loss prevention approach, no? And I will just focus more on how we really manage in converting the positive, the culture, the OSH culture of our workplace into a positive one. And one of this is we have this change in mindset that OSH is everyone's responsibility. This encourages management by walking around, and we encourage a bottom-up initiatives, initiatives, and it encourages more involvement. And of course, in terms of our actions, we focus more on the proactive one. And in terms of addressing issues and problems, we focus on behaviors, because as we all know, behavior is 90% of the root causes of all our incidents, issues, and problems in the workplaces. And we focus more on root causes. because if we identify the root causes, we identify the corresponding actions, and we solve the problem. And lastly, we focus on positive reinforcement. We do away with fault finding, and every issue, every problem, every accident or concerns, we take that as an experience for our workers. And this is the table sharing on how we change the mindset as we implement our loss prevention system, coming from the behavior-based system that we implemented earlier before 2018. And this is also I would like to share on how we all our employees are gauged and make a self-assessment. We start from the bottom. So as we start our program, we have an assessment for self-assessment, and we call this a SPICE model. And the lowest bottom is yourself. So all our employees are assessing their commitment or the level of where they are now. Are they doing their job because they wanted to keep their job? And second, it's political. So did I do it because I want to satisfy my boss? Those higher from higher position. And third is the intellectual. I understand the importance of my job. That's why this is already on the higher level. And the third is emotional. So you're already passionate about the need to do your job. And of course, if it's already a way of life for you, then you already reach the level of spiritual. So this is how we integrate and inculcate OSH to our workers. So we also had this spotless operation. No? We encourage. We print this media and the display in the strategic areas of our operation or terminals, and to remind our employees that we have to maintain the zero lost time incidents in our operation. So we call this spotless operation because we don't want to have a lost time incident within the scope of our operation. And also part of our engagement with our service providers, because Petron is also very into third-party service providers outsourcing. So we have many third-party service providers. So we integrate our third-party service providers with our program on loss prevention system, and we implemented the Project Superman. This is coaching and mentoring our third-party service providers on how they will implement thoroughly and sustainable implementation of the loss prevention system. And also, we maintain the Kapatiran YSTAV program. This is a CSR program and the engagement with our service providers. And we help them comply and implement the OSH program as mandated by the government, and of course by our corporate requirement to coexist as our service provider. So we help them comply by having this WISE Kapatiran program. So for ours, that's why in our case, we implemented different programs like for our security guards, where this monthly inspection, training, orientation, quarterly recognition, and annual recognition for our security guards. Security guards are also service providers. They are outsourced employees of the company. And our contractual and contractors involved in our operation, filling operation, maintenance. So we also have a different program for them. We call it MOGAS 4C. And we have the drivers. So all our drivers for our trucks and hauling fleet, delivering to our customers, we are training them. We're integrating them to our OSH program. And we also recognize them every quarter and every year. So we have also a program for our regular employees. We call it Project Honesto. So we appraise our regular employees every 6 months and every year, and the appraisal results are also forwarded to our HR as part of the annual appraisal of our regular employees. And also there are employee relations and family welfare program that we implemented just to integrate the family aspect of our employees, their family. We have to give them also the chance to be part of our OSH program, not only as part of the employee circle. So these are just sample pictures, and in this we have also an actual training ground for our firefighters at the terminal, and we cater external parties for emergency responders of the community, Bureau of Fire, and of course we trained this is a national training ground for all our employees of Petron and also our customers as part of our after-sales service. So with that, we made flesh the OSH program of Petron Corporation. Thank you very much, PCOM. Padayon OSH champions.
Thank you, Engineer Ortega, for all those practical tips and even mnemonics. No? And do not worry, Engineer, we have plenty of non-medical participants. No? Everyone is welcome in our Kapihang OH. Dear participants, let us welcome our last speaker for tonight, Dr. Marilou Renales.
Thank you very much for your kind introduction. Allow me to share my screen.
Go ahead, Doc.
Good evening, everyone, and I thank you, the PCOM Quezon City chapter, for inviting me to be a part of this very memorable event on the eve of the World Day for Safety and Health at Work. So the topic that was assigned to me tonight is about the occupational health physician's role in the development of a positive safety and health culture in the workplace. For the outline tonight, just very briefly, we have an introduction, the benefits of a positive OSH culture, the duties of the occupational health physician for our review, and the role of the occupational health physician, which is my topic for tonight, and just to summarize for you. So for the introduction, we all know that this 2022 theme is to build a positive safety and health culture. Let's act together. My discussion is based on this report, Enhancing Social Dialogue Towards a Culture of Safety and Health. So OSH should be integrated into every aspect of the enterprise's dealings. Leadership is a highly visible commitment to OSH by employers and top management. OSH training and information should be provided to all workers. This contributes to reducing work-related accidents and diseases and improving workers' well-being and morale. The second topic, the benefits of a positive OSH culture, again based on the report of the ILO. So for the workplace OSH culture, this may be described as the product of individual and group values, attitudes, perceptions, competencies, and patterns of behavior that can determine the commitment to and the style and proficiency of an organization's health and safety management system, which you have seen as an example of the best practice guidelines from Petron as delivered to you by Engineer Ortega. Now, the OSH culture has three components. One, psychological, the second, behavioral, and the third is situational. For the first one, psychological, this will consist of shared values, attitudes, perceptions, and beliefs that drive decisions and behaviors regarding safety. For the second, behavioral, these are methods regarding safety in the workplace. And for the third component, situational, these will include policies, procedures, regulations, organizational structures, and management systems related to safety. Now, at the workplace level, the employer's responsibilities will include, of course, to ensure so far as reasonably practicable the workplace's machinery, equipment, and processes, and under their control are safe and without risk to health, even for the chemical, physical, and biologic agents which are supposed to be without risk to health under their control, and provide where necessary adequate protective clothing and equipment, and provide where necessary for measures to deal with emergencies and accidents. And lastly, ensure that there are arrangements in place in which workers and their representatives are consulted, informed, and trained on OSH. Now, at a workplace for the workers' rights, receive adequate information and be given training on OSH, ensure into and be consulted with the employer on all aspects of OSH associated with their work, and remove themselves from a work situation if they have identified it, which they have reasonable justification to believe that it presents an imminent and serious danger to their life or health without undue consequences. How about the responsibilities? Workers will cooperate with the employer in the field of OSH, take reasonable care for their own safety and that of other persons who may be affected by their acts or omissions at work, comply with the instructions given for their own safety and health, use safety devices and protective equipment correctly and not render them inoperative. Report forthwith to their immediate supervisor any situation which they have reason to believe could present a hazard and which they cannot themselves correct. Report any accident or injury to health which arises in the course or in connection with work. The third topic, let us review the duties of the occupational health physician based on the Department of Labor and Employment Occupational Safety and Health Standards, which is still in progress. So I will just present you what is existing based on the 2020 edition. And so this is the duties, these are the duties of the occupational physician, whether part-time or full-time. And our task is to promote and maintain the health and well-being of the workers so that they will be productive in the workplace. So if you recall, for those who are OH physicians here, it is about the program, organize, administer, and maintain. So it's sustainable, it's continuous. Next is continually monitoring the work environment for health hazards. And we heard about periodic inspection or audit from ASEC Cucueco. So that's part of our task. The third one, as we recall, prevent diseases or injury in the workplace by establishing proper medical supervision over all the substances, processes, and work environment. The fourth one is health conservation through examinations and health education. And then the fifth one, is to provide the care, the medical and surgical care, as within our limits to restore health and earning capacity of injured workers. And number 6 is repertorial, the requirements of submitting the annual medical report. And we do appreciate ASEC Cucueco for presenting the submission of all of these reports. So we need to maintain and analyze records of all medical cases and prepare and submit to the employer. The 7th, conduct studies on occupational health within our means and resources and act as an advisor. This is where we can act together to management and labor in all health matters and report directly to top management in order to be effective. So you got the review right now. So I hope that you will just really memorize this by heart, and it's part of your terms of job or your job description. So what is a positive OSH culture based on the ILO report? one in which management and workers value the right to a safe and healthy working environment and actively participate towards its end. Now it is built on open communication dialogue, as we have heard even from Executive Director Binag talking about that dialogue between workers and employers, and wherein workers feel comfortable sharing their thoughts and incidents and concerns. And they're not afraid to tell about it. Now, these are the 7 core values in positive OSH culture. One is social involvement, justice, trust, sustainability, participation, resilience, and flexibility, development, and growth. Now, since the pandemic and still continuing right now, even though we feel it's post-pandemic, we still have a lot of challenges, and we appreciate that ASEC Cucueco has shared that with us tonight. And so, for our role, and this is the last part, the role of the occupational health physician. The first one, this is based on the report of the ILO of building and maintaining a preventative safety and health culture. Yes, we are in a curative task, but it's not all about curative. It's more prevention. So it's a culture in which the right to a safe and healthy work environment is respected at all levels, where governments, employers, and workers actively participate in securing a safe and healthy work environment through a system of defined rights, responsibilities, and duties, and where the principle of prevention is accorded the highest priority. Principle of prevention, may I repeat, is accorded the highest priority. So let us remember that. And so the first role is being an advocate for building and maintaining a preventative safety and health culture. How about the second role? Now, at the workplace level, we need to ensure that there's compliance with the OSH regulations. And we have integration of the OSH management system and culture change to achieve a positive OSH culture based on the ILO report for this year. And so the second role is promotion of compliance with OSH regulations. And the third one is about a positive OSH culture, which will include the open communication and dialogue, and where workers feel comfortable, and there's leadership and commitment to OSH by employers and senior management. And the stages of development, as elaborated a while ago by the message of Executive Director Binag, from pathological to reactive, calculative, proactive, and generative. We need to move forward to the proactive at least and to the generative, but most enterprises are still in the reactive stage. And we really thank the government for that one, the Republic Act 11058 and the Department Order 198-18, and for ensuring that we can comply. And so the third role that I see in the OH physician is collaboration with both management and workers in the development of OSH programs that will entail worker participation. And so these are the 3 roles that I see based on the 2022 World Day for Safety and Health at Work. Now, for the last slide, I would like to summarize what I have just discussed. And so for the benefits of a positive OSH culture, both workers and management value the right to a safe and healthy work environment, and also with an open communication and partnership. So the roles, may I summarize with you? First, be an advocate for building and maintaining a preventative safety and health culture. Second, to promote compliance with OSH regulations. And the third one, let us collaborate with management and workers in the development of OSH programs that will entail their participation so that we can act together with both management, the government agencies, and also the workers as a whole to build a positive occupational safety and health culture in the workplace. So with this, thank you so much. This is the end of the presentation, and good evening to everyone. Dr. Jason.
Thank you very much, Dr. Renales. especially for emphasizing the need and benefits of OSH culture building. Can we invite you again and Engineer Ortega for the certificate presentation? On behalf of the PCOM Quezon City chapter, let me present the certificate of appreciation to Engineer Joey Ortega, Terminal Manager, Petron Harbor Center Operations, Petron Corporation, for serving as resource speaker of the chapter's 39th Kapihang OH. Maraming salamat po ulit, Engineer Ortega.
Thank you, PCOM.
With the same citation, let me present the certificate of appreciation to Dr. Marilou D. Renales, Auditor, Quezon City Chapter, Philippine College of Occupational Medicine, for serving as resource speaker of the chapter's 39 Kapihang OH. As always, salamat po, Dr. Renales.
Thank you very much.
So once again, thank you to all our respected speakers for tonight. The discussions are very rich indeed, no? And at this juncture, let us officially start our open forum. Dr. Taylor, may I ask for assistance to spotlight our speakers? However, there are other important engagements, and Dr. Yuka Ujita will not be able to join our Q&A, but we still have our three very distinguished guests with us. So to start the ball rolling, maybe if I can address the first question to all our resource speakers. So the first question is about culture building, especially during the pandemic. So the question reads, how will we promote a positive OSH culture in a company that's currently downsizing due to the pandemic? Maybe this is very related to Dr. Renales' presentation. If I can ask first for your inputs.
Yes. Because of the pandemic, many companies have been downsizing and retrenching employees. The first thing is, let's collaborate with HR. Why? HR knows well how to tackle their employees. And if we can be of help, is really to look after, because this will entail a lot of mental health challenges among the workers who will not have any jobs anymore. Because if they are part of those who will be retrenched, so that's a big thing to them. And also looking at compliance, if they will receive some prorated salary, all of these are about HR. But of course, we are there as an OH physician. I would say, let's look at stress management. Let's look at how we are going to assist the company to be able to help all the employees so that they will not be suffering from mental health challenges, especially this pandemic. Many are succumbing to these challenges in mental health. So that's my take on that, Dr. Cabigon.
Thank you, Dr. Renales. If we can hear the inputs of ASEC Cucueco.
Yeah, okay. Can you repeat that? I was just in another call.
No problem po, ASEC. So ASEC, the question is about culture building during the pandemic. So there are reports that companies are actually downsizing. So any advice with regards to the culture building, particularly sa OSH, especially with the difficulties that the companies are actually encountering at the moment?
You know, because this is safety and health and it is a culture, despite the challenges, it should still continue. Safety and health is not just there if you're a large company, but or more so if you're downsizing and you're also looking at other processes, you have to also now address and adopt other behaviors. Kasi dati siguro you had more vehicles, you had drivers. Now you're going to a delivery type or different. Isn't that where now let us assess your risk? you in safety and health, you are going to look at a different type of risk. It may not be as the same risk, it will be different, but there will still be safety and health. So again, it is an activity. It is really a way of evaluating how you can do your work safely and well, and still maintain the health of your workers. You're downsizing. Number one, contractions will happen, physical space, but then you will also, that's why the adaptations will continue. Now assess through the risk and look at your different and prioritize. And it should not, whether you increase, you decrease. The important thing is you now have to, again, look at safety and health. Kaya risk assessment na talaga ang basis natin, because it may be different, but you will always have safety and health concerns which should be addressed. Yun lang po. Thank you.
Thank you po, ASEC. Engineer Ortega, any thoughts on this?
Hi, Doc Jason, Dr. Tess, and Dr. Marilou.
Hi,
Hi
Joey.
po. So sa amin siguro sa private sector, three things na gusto ko lang i-highlight. Una is transparency. So the moment kasi that we are transparent to all our workers and employees, and the tools of consultation and participation are highlighted during the process. So mapapaintindi naman natin sa mga workers yun. Second, we are fortunate enough that the oil industry, especially the oil industry, medyo kahit sinabing mag-downsize, mag-downscale yung operation, ay medyo andun pa rin kami kasi we are in full support for the national economy. Nandun pa rin, wala namang in fact, the third point that I want to emphasize is nung nagkaroon na talaga ng impact yung pandemic is ang ginawa ng top management through our HR ay nagkaroon tayo, yung pinaka-vulnerable natin kasi ang inuna natin na sinuportahan. Ano ito? Sino-sino ito? Ito yung aming mga third-party service providers. Kaya kung makikita ninyo sa mga press release ng aming boss, si Mr. Ang, we first help out our third-party service providers. Kasi sila yung pinaka-vulnerable talaga. And good thing it was na-sustain to, na-sustain. Until now, wala namang ganong kalaking impact, especially for Petron. So yun po, Doc.
Thank you. Thank you very much for all those inputs. So to summarize, there's still a way, there's still a way to ensure that the culture of OSH will still be advocated. So there's another constant question that I am seeing in the chat is about the hesitancy perhaps of the company to comply, maybe because of financial reasons or any other reason. Can you give us an advice on what should be done if the company is actually hesitating to comply for whatever reason? If we can start siguro with Engineer Ortega. Have you experienced this before?
Pag ang occupational safety and health culture kasi it really starts from the top management commitment and leadership. So doon mag-uumpisa siya. So kung mataas ang commitment na yon, yung hesitancy siguro ay ano na lang yun, down the line na lang siguro yun. Pero as an OSH advocate, as an OSH consultant, ito rin yung nagiging advice namin sa aming management. When we do the risk assessment, basically the minimum that we have to comply are the regulations, the regulatory requirements. Even with our contractor service providers, ini-integrate namin yung OSH regulations doon sa mga kontrata, sa mga aming mga engagements. In fact, even yung mga promotion like the LPS that I've shared earlier, kasama na siya ngayon sa contract namin na dapat yung third party namin isusulong na nila ito, i-implement nila kasi nakakontrata sila sa amin. So yung hesitancy, I think kailangan talaga ang i-address natin yung top management commitment and leadership. Yun yung sa akin.
Thank you very much, Engineer. I guess you are very lucky that you belong to a company with OSH being the priority. But unfortunately, there are still companies, or even the medium and the small ones. I'm not saying that they are not prioritizing, but rather maybe there are some deviations, no, from the standards. And for those, maybe Dr. Renales, if we can have some inputs pertaining to those
Yeah.
particular situations.
Yeah, so by experience, I've been, I've encountered some companies which are like that, but really patiently, just continuing to educate them on the standards, educate them on, right, like right now, we have the 19818 and also the 11058. It's much easier right now, right, Engineer Ortega? It's easier right now because there is already a mandate, there is a law. Unlike before, that we will not get penalized. But when they see the fees, so continue to educate. That's for me. And finally, it may take a year, but when an inspection happens, then they become scared. Even for the medium enterprises, medium-sized enterprises, so they get scared. Then they ask me, how will we going to solve this? Ano nangyari ba? Bakit ganito? Ngayon ko lang ito nalaman. Tagal na akong sinasabi sa inyo eh. But they got inspected. So, if you're the OH physician there, tiyaga lang. Just be patient. Continue to collaborate. Continue to educate. Because you really have to explain. It's up to you to really explain. And together with the Health and Safety Committee. Kung may Health and Safety Committee, that's a very good step. Nagko-comply na. Di ba, right, Engineer Ortega? No? Kasi kung walang Health and Safety Committee, ayun, matagal pa. Matagal pa magkaroon ng, yung sa developmental stage, pathological pa rin. Kasi that's a very basic committee, Health and Safety Committee. That's all, Dr. Jason.
Thank you very much, Dr. Renales.
You're welcome.
ASEC Cucueco, if you have furthermore inputs with regards to
Non-compliance. I was laughing at that question. They don't comply. That is non-compliance. And that's going to apply. And you know what I noticed with this pandemic is even if they say you're not complying, your workers complain. And we receive the complaints and we act on the complaints. More than routine inspection, we go immediately to complaints because that is a priority for the DOLE. You think they do, they will. And we have a lot of these complaints. But if you just think an accident and how much an accident will cost versus having a safety and health program, you can imagine the savings. And you can also imagine your headache if the DOLE comes in and tells you all of this and you're given just a limited period. It's willful violation where penalties will apply. We don't like that. That's why we need you to tell them, this has to be in your mindset. This has to be a value you carry because it's important. This is life. And that is safety and health. That's all.
Doc Jason, dagdag ko lang din.
go ahead po, Engineer.
Practical tip lang siguro, lalo na ngayon. I wanted to promote din the GKK award, kasi itong mga award and recognition, this offers a free audit, free inspection to your company. And pag nagkaroon ng mga inspection na ganito, hindi ka mapupunta sa penalties or violation kasi this is an award. So actually, ito yung sinishare ko during yung promotion of the JKK, at first, when I joined the JKK, I just wanted a free audit from DOLE. Fortunately, we won the award, But the initial step is just to help our HSE committee na magkakaroon ng free audit as a baseline, as a benchmark data for our HSE program. So yun lang, practical tip, Don't treat the inspectors as police officers, Let us collaborate with our Department of Labor inspectors. They are friends, malaking tulong yan, we improve our liaising activity with our DOLE friends, Kasi dito tayo matututo. Ayun lang po. Thank you.
And I like to add some more that look at them as a collaborative help, networking, instead of pinopolis ka. Kasi iba ganun talaga ang tingin. So you have to help them transform, renew their mind, in other words. Oo, kasi ang tingin nila penalty. So hindi yun They don't see the value. Kaya nga, it's really the culture Dapat magkaroon ng OSH culture. Ayan. Positive OSH culture. That's all, Dr. Jason.
Thank you po. Thank you po for those reminders. And for our last question, I'm seeing one question related to our topic regarding the financial and internal processes of the organization. So the question reads, what are your opinion on aligning OSH programs relative to financial and internal process key performance indicators in an organization in support of inculcating a positive culture on OSH? So aligning the OSH programs relative to the financial and key processes of the organization. So any inputs po or particular experience with regards to this? If we can start with Dr. Renales.
First of all, if the company has commitment, it's very easy to integrate. Very easy, especially a multinational. When I work with multinationals, they really input already the OSH. So even the programs are there. So that's their performance indicators. Okay, so it depends. But then if we have medium-sized or if we have especially the small sized establishments, that would be harder because what they're looking at is still productivity, profit. Yan, lalo kung for-profit organization. So it depends on the type of company. But OSH, according to ASEC, di ba? And it's in the law, it should be for all types of enterprises. There's no excuse. We're not having or even starting just to really have the positive OSH culture that we need. Ayan. Mindset talaga yan. Sabi nung isa na nagko-comment. So that's all, Doc Jason.
Thank you, Dr. Renales. Engineer Ortega, any inputs on this question?
Yeah, for in our case, no, it's integrated na talaga doon sa aming operational, financial, sa financial, namin, KPIs. In fact, kung makikita ninyo kanina sa first few slides, kung meron kami doong yung mission, vision, mission, and values. And the third mission is yung Occupational Safety and Health. So yung pangatlong mission na yon, meron siyang kaakibat na KPIs, no? Na every year ina-appraise, ina-assess kami, no? Per terminal, per location. And in fact, there is a recognition ceremony every year with that, no? As an integration to the operational and financial KPIs of the company. So yun nga, sabi nga ni Dr. Marilou kanina, no? Mahirap lang siya doon sa mga MSMEs talaga. But if we realize kung ano yung cost ng aksidente, kasi yun naman palagi, no? If we take yung kumbaga pinaka worst case scenario ng isang accident or incident, mas yun lang kasi ang hindi pa nare-realize eh. Kaya nga sabi nga nila, kung gusto mo ma-realize yun, try accident. So yun. So I'm talagang magandang naka-integrate siya doon sa ating financial and operational KPI. Thank you.
Thank you. And from ASEC Cucueco, if there are more to add.
Yes, I have more to add because, in 198 and 11058, the cost of an OSH program is part of the OSH program. It is embedded because you will always have cost for training, cost for the PPE. If you do not put the financial resources that are needed, your commitment is so superficial. Polisiya lang. You are not walking the talk. And you need to walk the talk. That safety and health is not just a paper, nor is it just showing the inspectors you have this, because the inspectors will go beyond that. And that is why even in the program, that is already part of what is required in your program, the cost. Although we remove, it's not for the it's not a necessary component for the micro because it could really be but we are saying the other, other components of safety are important. But once you reach a bigger size, like 51 and above, and a medium risk, it's already, your costs are part and parcel of the OSH program that you should be submitting. Kung hindi nyo pala sinasubmit yan, teka ha, sasabihin ko sa regional office, tingnan yung mga programang sinasubmit sa ninyo para makita natin. Kasi kasama po yan. Again, that is your commitment. That is why what we say, your financial commitment will also tell the people how you are going to implement your program. I have to leave now also, no? This is the last question. Thank you so much for inviting the DOLE. Thank you, Joey, Marilou, and everyone else.
Thank you, Doc.
Happy celebration of World Day for Safety and Health. Labor Day na rin will be coming up. And hope to see you all soon. I have
Safe.
pasensya na.
ASEC.
No worries, ASEC. In fact, take home message na rin po yung i-request ko for
Mauna na siya.
Thank you po. Thank you, ASEC. And with that po, since ASEC already started ang take-home message natin, if we can ask a take-home message from both of you. And if you have other questions that you have seen in the chat that you would like to answer, maybe this is also the time to address them. And of course, your message for the World Day for Safety and Health at Work. Dr. Renales, if we can start.
Okay, yeah. So my take-home message is that let us not forget the 3 roles that I discussed tonight, because we should really pull our act together with management and the workers so that we can inculcate that positive OSH culture.
Thank you. Very brief and very concise advice from Dr. Renales. Engineer Ortega, I think,
Yes.
Engineer, my question particularly for you, regarding the change of mindset.
Yeah. So, ano yung questions, Doctor?
Regarding the LPA, so what will be the main...
Sorry, nasagot ko na rin siya kanina pero baka natabunan lang. That's LPSA, Loss Prevention Self-Assessment actually. So it's an undocumented, It's a mind controlled risk assessment. You just memorize the AAA, the assess, analyze, and act. So meron kaming mga protocol na tinuturo with that tool. Yung tool na yun can really help, Kasi yung sinasabi sa RA 11058 na yung work stoppage, hindi na namin kailangan yun kasi the worker himself or herself, pag alam niyang unsafe na siya, he will stop working or he will not report to work. So yun yung tool na yun. Actually, ang stewardship ng tool na yun is really powerful also because it will encourage enhance relationship management pag nai-steward mo siya, kinakausap mo yung worker every day. So yeah.
I see. Take home message, Engineer.
Yeah, siguro promoting positive OSH culture in relation to the 2022 World OSH Day. So the power of collaboration, hindi lang sa safety officer, hindi lang sa management, but at all levels of the organization, kahit sino man siya, basta parte siya ng workplace, dapat sinasama natin siya sa collaboration, and that promotes participation and consultation process. So yun. Thank you. Thank you, PCOM, and congratulations, PCOM.
Thank you very much po ulit. And happy World Day for Safety and Health po sa inyo, all to our participants. So very fruitful evening indeed. So at this point, let us proceed to the remainder of the program. I would like to thank our PCOM Quezon City Chapter Virtual Kapihang team led by our technical head, our very own PCOM Quezon City Chapter Secretary, Dr. Jose Angelo Taylor. Thank you very much, Dr. Taylor. Also, this webinar will not be possible without our PCOM Quezon City Chapter CME team headed by Dr. Maria Cecilia Diana. Thank you very much as well. To formally end tonight's educational activity. Ladies and gentlemen, our Chapter Vice President, Dr. Jeremias M. Florante.
Thank you, Dr. Cabigon. Two years in a row, the Quezon City chapter of the Philippine College of Occupational Medicine has been actively supporting the commemoration of the World Day for Safety and Health at Work as part of its advocacy activities. Tonight's remembrance promotes building a positive safety and health culture, not only within the establishments, but also in the workers. That is changing the workers' attitude toward fulfilling tasks at work without sacrificing their safety and health always. It is the chapter's prayer that the theme of this year's observance will be imbued by each and every one of us here so we can have a safe, healthy, and productive nation. At this juncture, allow me to express our warmest gratitude to our resource persons, Dr. Yuka Ujita of the International Labor Organization Decent Work Technical Support Team for East and Southeast Asia and the Pacific, Assistant Secretary Maria Teresita Cucueco of the Department of Labor and Employment, Engr Joey Ortega of Petron Corporation, and Dr. Marilou Renales, the chapter's auditor and a DOLE accredited Occupational Safety and Health Consultant, for their input so we could better instill this positive culture and behavior in our workers. We would like to thank our supportive participants who are advocates of occupational safety and health from different industries. Special mention, though, to the college's national officers and board of directors, led by Dr. Ana Sofia Victoria Fajardo, and to the general membership, including the past national and chapter presidents. Special mention as well to our multi-awarded teams, headed by Doctors Jose Angelo Taylor and Maria Cecilia Diana, for their untiring efforts in making every Kapihang OH a huge success. Again, thank you very much to everyone. Tonight is the premiere night of our 38th Kapihang OH. To those who were not able to attend or would like to review the travel regulations imposed by the government during this pandemic, please watch it out on our official YouTube channel. To be updated on our uploaded videos, do not forget to subscribe and hit the notification bell of our channel. Kindly like and share our other social media pages on Facebook, Twitter, and Instagram. If you have comments and suggestions for our next Kapihang topic, you may reach us at PCOM Quezon City Chapter at gmail.com. Until our 40th Kapihang OH, thank you. Always remember that in Quezon City Chapter of the Philippine College of Occupational Medicine, we value your safety and health. Hashtag PCOM QCC Cares. Ingat.
Thank you, Dr. Florante. Thank you, everyone, for attending our 39th Kapihang OH. That's 39 very valuable, timely, and most importantly, free learning for all. If our sessions actually helped you, what we only ask is for you to subscribe to our official YouTube channel, like our Facebook page, follow our Twitter and Instagram accounts. All our past sessions are uploaded in our YouTube channel. And don't forget to like, share, subscribe, and hit the notification button. Again, it's free. They are all free. Check out our channels. Just search PCOM QC in all those social media platforms. And your support will move our chapter to even more projects that will benefit everyone. Again, thank you very much. See you in the next 40th Kapihang OH. I am Dr. Jason Jan Cabigon, always reminding everyone that in PCOM QCC, we value your safety and health. Hashtag PCOM QCC cares. Happy World Day for Safety and Health. Good night, everyone.